welcome back to another video of Medic Notes. This video I'll be talking about post-traumatic stress disorder, PTSD. PTSD is a prolonged response to a traumatic event, such as abuse, serious road traffic accident, natural disasters, violent crime, torture, or terrorism. The traumatic event should be extraordinary and most people should find it traumatic. For example, one cannot suffer from PTSD after failure in an examination because it is not as traumatic as a serious road traffic accident. The development of the PTSD symptoms is usually within 6 months after the traumatic event. The main symptoms include re-experiencing, such as having flashbacks of the traumatic event during daytime or having nightmares at night, avoidance, such as avoiding the place or objects or people who are associated with the event. Hyperarousal, where there is increased vigilance, irritability, poor concentration, and exaggerated stutter response. And emotional numbing, which is detachment or has shown lack of interest in daily activities. So there are some of the questions we can ask regarding these 4 symptoms. For example, if the person had a terrifying road traffic accident causing some traumatic PTSD, for re-experiencing, we can ask them, how long after the accident did you start getting these symptoms? And what does the memory relieve itself? How vivid is it? Does the memory come in the form of repetitive distressing images? And how often do those images come in a day? And do you have any nightmares at night? For avoidance, did they try to avoid driving a car or sitting in a car? And did they try to avoid the place where the accident occurred? For hyperarousal, we can ask whether they are always feeling on edge. Do they have any excessive sweating, fast heart rate, and difficulty in breathing? And how has their concentration been recently? Emotional numbing, we can ask, are they able to describe their emotion and do they feel emotionally blunted? To diagnose someone as having PTSD, this is the DSM5 diagnostic criteria. So the individuals diagnosed with PTSD must have had an exposure to a severe or threatened death, serious injury, or sexual violence. To fulfill the diagnosis, the following symptoms must be present, which include repetitive, intrusive, and distressing memories of the traumatic event, marked efforts to avoid those distressing memories and external reminders, can be objects or people, and dissociative amnesia towards important aspects of the traumatic event, where they only remember parts of the traumatic event. They don't remember the whole event. And these symptoms must have resulted in marked impairments in terms of their psychosocial functioning. There is a questionnaire, which is the Impact of Events Scale, IES, to assess the symptoms of intrusion and avoidance. It also assesses the self-reported levels of distress with regards to a specific life event that is used in PTSD. For management, if the symptoms are mild and have been present for less than 4 weeks after the trauma, the doctors can offer reassurance and close monitoring of the patient. If the PTSD symptoms persist after 1 month, then the following treatment can be offered, such as pharmacotherapy, where SSRI, the selective serotonin reuptake inhibitors, are generally the most appropriate medication of choice for PTSD, and effective therapy should be continued for 12 months or longer. The drugs, SSRIs, that have been shown to be efficient are paroxetine, sertraline, and fluoxetine. Other than the pharmacological treatment, there is also psychological treatment, where studies of trauma-focused cognitive behavior therapy, which is the CBT, has shown to show the most effective results in the treatment of PTSD. The cognitive behavior therapy, trauma-focused, involves exposure therapy to overcome avoidance associated with the accident. Another psychological treatment is called the eye movement desensitization and reprogramming, EMDR, where it involves recalling the traumatic event when the patient performs a dual attention movement, such as bilateral hand tapping. The objective of EMDR is to give a new insight to the accident and also reduce the patient's sensitivity to negative re-experiences. That's all for this video. Thank you.